what is super, super important to them as far as prevention and management? If you had to leave someone with one thing that they should know going into their day as far as either preventing or managing diabetes, Dr. Rilwan, what would you tell them?
So basically, what I can say is the number of people living with diabetes is growing worldwide, and more so in Africa, and even more so closer to home in Kenya. And the figures are rising. And anybody could be one of the persons who can end up living with diabetes. And so I would want to emphasize prevention. Diabetes is a lifestyle condition, in the sense that how you live your life, the food that you eat is very important. And then in our setup, we tend to have a carbohydrate-rich diet.
Sure.
Which is...
Ugali, half the plate.
Yes.
Standard.
Which essentially... should not be the case. But then again, it depends on the activity level that you have. Do you really need that much energy? Remember, carbohydrates are energy-giving food. So if you're not expending that much energy, do you really need that food?
I like that. Usikule kama mtu wa mjengo, kama wewe si mtu wa mjengo.
Exactly. Yeah. And so if you're not expending that energy, you don't need that much energy. So we need to really look at what's on our plates. We really need to look at, I know there is urbanization, a lot of urbanization, which is good. The transports have improved and people are walking less and using more of borders. I want to encourage everybody to walk. The guidelines actually recommend everybody at least should have at least 10,000 steps, which is about 6 to
kilometers a day. Yes.
Which is quite substantial.
Doctor, it's not as easy to reach. Yes. We tried to get at least 6K, 7K, 10K na kwanga, but we try. You try. Or you panda stairs instead of the lift.
Exactly. Yeah. Or park further away. I see people struggling to park closer to where they're going.
Yes.
It's better to park a bit further and you walk. So at least let's get more into the active lifestyle instead of the sedentary lifestyle. I think I would want to emphasize on that, and especially even for the next generation, because we're getting a lot of children who are going into obesity. Obesity is a huge risk factor for diabetes. Apart from being a risk factor, obesity is now classified as a medical condition, as an entity. So we need to prevent that as well, because they go hand in hand. And so more so for the coming generation, because we're doing a lot of fast foods as well.
Yes.
So we need to really look into that. I want to leave us with that message. So apart from prevention in terms of your lifestyle, there's also looking at your family history, and I think emphasizing more on the screening. And when you do your screening, preferably try and do even a fasting sugar in the morning, if possible, at least like Dr. Shilpa mentioned, if not once a year or even more regularly if you have a positive family history.
Right.
So look into that. And then for those people living with diabetes, I want to emphasize follow-up, because again, we get those we diagnose with diabetes, we put them on medication, they realize that their sugar is good most of the time and a few times up and down. I want to emphasize follow-up with your clinicians. It's really quite important, because most of the complications associated with diabetes are quite silent. So you need to have your annual eye checks done. So at Lions, we have the eyes, which we check. Even if you do not have eye symptoms, every person living with diabetes must have their eyes checked once a year. So even if without symptoms, please have your eye checked. Your regular foot check should be done. I think Dr. Shilpa will mention more on that. And even for the kidneys, kidney complications are silent until you reach end-stage renal disease, kidney disease. So there are tests that we do at least in a year to check whether your kidney is functioning normal. So I want to emphasize follow-up. I know follow-up can be quite difficult, especially if you're far and your clinician is far. At Lions, we are now embracing technology. We have a telemedicine platform, so we tend to reach our patient as far as you know, we get patients from all over the country.
Yes.
So we are able to reach them from wherever they are, at least to do the follow-ups that we can for them. I emphasized on education. People living with diabetes, please learn the condition. Please talk to your clinicians. If you have questions, don't be scared to ask questions, because these are lifestyle condition. You live with it every day. You experience different challenges. Bring the challenges to the consultation room so that we can discuss them. And as that, I emphasize on education. And at Lions, we also have support groups for our patients where they come and they discuss, because they live with this condition and they can talk to each other and understand each other better, how they're overcoming certain challenges. And so the support groups, we really emphasize on subgroups as well.
Thank you so much, Dr. Rilwan. I'll ask Dr. Shilpa very, very briefly perhaps to talk about the foot and wound clinic, of course, at Lions Side First Hospital, what it offers and why it's so important to have that multidisciplinary approach.
Yes, thank you very much. Multidisciplinary approach is extremely important when it comes to foot and wound. I cannot individually manage a foot. I have a specialist podiatrist, Dr. Collis, with us on the team. We encourage checks at least once in a year in every person living with diabetes to check on the nerves, to check on the blood circulation, classify their risks, and then tell them how often to come by. Footwear is extremely important. We are to bespoke footwear sometimes for certain persons, and we can advise that. In regards to wounds, we teach every person living with diabetes who comes to us the red flag signs. Any redness, any abnormal warmth, just because it hurts doesn't mean it's not dangerous. Please come, have us take a look at it. Don't do bathroom surgery by yourself. Please come, consult us. We'll tell you how to go about it, and we can prevent a lot of needless amputations because we work as a team. We have multiple services in regards to specialized dressings that we use, and we do guideline-based treatment. We do negative pressure. We also do a unique form of oxygen therapy. It's not hyperbaric. It is a homegrown technique which we are very proud of at Lions, and we've seen very good results with that for certain wounds. Having said that, look at your feet before you sleep, and that's basically all I have to say.
Have a look at your feet before you sleep, yeah? Thank you so much, yes, Doctoris.
Be careful with your pedicures.
Yes,
people living with diabetes.
Okay, I like it. That's something to look out for, yes?
Yes, please. Thank you, Dr. Rilwan. Please use your own instruments and tell them not to take off the cuticles, please.
I think that should be for everyone, right? No one's cuticles should be taken off. Of course, thank you so much, Doctoris, for spending the morning with us, for informing us. I'm going to give you something we call Makofi Ka Olomide, which is just saying thank you for the information and for the time you've taken today. We have to